Good morning. On behalf of the IIP Digital team, I, Dr. Manisha Tarpalikar, welcome you all for today's session. To celebrate Women's Day, the IIP WC Kamrup District, Assam has organized today's event. The topic of today's webinar is common cancers in females. The webinar has been organized in collaboration with the Department of Physiotherapy, Dr. B. Baroa Cancer Institute, Guwahati. Our speaker today is Dr. Srabana Bhagabaty, who is an associate professor and in charge at the Department of Preventive Oncology at the same institute. Dr. Urvashi Bhattacharya would be the moderator for today's event. We are live streaming on the official IIP India YouTube channel. I request all the participants to kindly subscribe to the IIP India YouTube channel to receive all the regular updates and attend the upcoming webinars. If any participants have any questions, please write them in the chat box so they would be answered by our speaker today. I now request Dr. Bhattacharya to kindly take over. Thank you.
Thank you so much, ma'am. Good morning, everyone. A very warm greetings to our speaker for the day, Dr. Srabana Bhagabaty, ma'am, panelists, participants for today's talk. I'm extremely delighted to welcome one and all to the webinar on common cancers in female. Before I hand over the session to the orator, I would like to take the opportunity to introduce her. Dr. Srabana Bhagabaty, ma'am, has an MD degree in preventive and social medicine. She is currently working as an associate professor and in charge of the Department of Preventive Oncology in B. Baroa Cancer Institute. Ma'am has more than 15 years of experience in the field of oncology. She has numerous publications in national and international journals, along with publication in abstracts and textbooks. She has also worked as a principal investigator in various projects and been awarded with many prestigious awards such as Healthcare Excellence Award, WHO Regional Director Special Recognition Award, Women's Achiever Award, to name a few. So now, without delaying anymore, I would like to hand over the session to ma'am. And here I would also request the participants to kindly raise their queries in the chat box, which will be addressed at the end. Ma'am, please.
At the outset, I'd like to thank the organization and the organizers of this wonderful webinar. Thank you so much. And so I begin my session. So I start my session. Yes, a question. Screen to share. Am I audible? Am I?
Yes, ma'am. Yes, ma'am. You're audible.
Okay. Okay. Previous slide. Can I? Okay. So actually, at the outset, I thank you all again, and let us go to the main topic. Today's topic that has been given to me is the common cancers in female, and because I am from the prevention and early detection field of cancer, so I'll focus on the prevention and early detection of common cancers in India. And so at the beginning, I'd like to say a few things about cancer, because all of us, we already are aware that cancer is a disease where cells grow out of control, where the law of universe is broken. Like they don't grow in a pace which they should grow, and they are not destroyed as they should be destroyed, and they are not multiplied as the way they should multiply. So it is out of control growth. So it is seen that approximately 39% of male and women with this, they will be diagnosed with cancer at some point of view in their lifetime. So this is the huge amount. This is a large amount. So large numbers of people are going to suffer. And the pathetic thing is, all around 80% of cancers, they come at a very late stage. And like in female, we can see this delay is even more. These delays are due to primary delay, secondary delay, and tertiary delay. And the primary delay is the major delay. In female, this is also very much true. And if we see from our experiences, that female usually they come much later than males. Now, these are men and women in India, the common cancers. We can see in women, these are breast, cervix, colorectal, ovary, and lip and oral cavity. But today I'm going to concentrate on the upper two, like breast and cervix cancer, and little bit of oral cavity cancer. The top 5 cancers in men and women, it accounts for 47% of all cancers. And these cancers can be prevented, screened, and detected early and treated at early stage. But due to many factors which contributes to this primary, secondary, and tertiary delay, it is seen that they come late. And late diagnosis is directly proportional to the, treatment, unsuccessful treatment, or increased mortality. And early diagnosis and early reporting is directly proportional to the good outcome. So this is very important to see through. We have to be very careful. We have to know the different signs and symptoms of cancers. And one pathetic thing that I should mention here, that very much preventable cause of death, it is tobacco. WHO has named tobacco as the most preventable cause of death. And it is seen that nearly 45% of all cancers in males and 17% of all cancers in females in India, and more than 80% of oral cancers are directly attributed to the use of tobacco. This is an NCRP consolidated report of hospital-based cancer registries. This is the database. This is the database, which is really very disturbing. And if we see tobacco-related cancer in both male and female, we can see that this is a glimpse of the list. The list is even more longer, starting from lip. Then you can see at the bottom there is cervical cancer, and many more cancers are being introduced by WHO in recent years. Like these are all tobacco-related cancer. Now, as a whole, today I'm giving more emphasis on female cancer, but here I have to mention that most common cancers all over India, including both male and female, we can see head and neck cancer tops the list, then breast cancer, then cervical cancer. Of course, in female, breast and cervical are much more, and in male, head and neck cancer is much more. But oral cancer, in some regions, we have seen some regions of northeastern India, or some regions where tobacco use is very rampant or bitter nut use is very rampant. We cannot say that it is less common. It is common. And oral cancer is most common cancer in India amongst men, and 5th most frequently occurring cancer in female, and the 3rd most frequently occurring cancer amongst men. If we consider both male and female, this is the 3rd most common. Now, cervix and breast in female, it accounts for over 50% of all cancer deaths in India. So it is not that only these are very frequent, but unfortunately, they kill a lot of people. They kill a lot of people because when they are reported, they are reported very late usually. Because people don't take that much of importance. They don't give that much of importance, or they don't know actually what if it is a cancer or something. A little bit of white discharge, a little lump in the breast, they are not that concerned. But this may be actually, in actual picture, it may be the starting point of this, cervical and breast cancer, which is so much common in females. Now, breast cancer is the most common cancer. It is seen that in India, it accounts for around 27% of all cancers in women. It is not that males do not suffer from breast cancer, but in female it is much more common. Now, rapid urbanization, in early years, it was seen that cervical cancer in female was more common than breast cancer. But with changing environment, changed lifestyles, we can see that breast cancer has become the most common cancer in female of India. There is rapid urbanization. Now the lifestyle of the female are changed. Late marriage, late childbirth, non-breastfeeding, alcohol consumption, increased stress levels, everything, lack of exercise, it has contributed to this increased number of breast cancers in females in recent years. Now, cervical cancer is the second most common cancer in India, and it accounts around 22.86% of all cancer cases in women. Cervical cancer is such a cancer which, if detected at a very early stage, it can be fully cured. And it is very easily screenable. We can screen it with very simple tests. So the main thing is a lack of ignorance amongst the female and their family members. Now, a little bit of oral cancer. The whole area I have shown, in these areas, we can see very commonly we have seen cancers. Now, risk factors of oral cancer, as you all know, it's the first and foremost is tobacco, then alcohol use, chronic trauma. Actually, this is the most often very much neglected thing that, okay, I have a bad tooth, it is constantly irritating my mouth, but be aware, be cautious, because this chronic trauma in later years may lead to oral mucosa cancer or oral cancer, you can see. So this is not to be ignored. Then very poor nutrition, if someone is taking very low fruits and vegetables are taken in very less amount, then poor nutrition may it may not prevent, you can say, the oral cancer. Actually, taking lots of fruits and vegetables, it is helpful in all kinds of cancer, because these have some such nutrition and such vitamins and such things in it that it prevents cancer to a great extent. Then human papillomavirus infection is another thing. Then like in our body, we have an immune system. And because of that immune system, we are surviving. Our immune system, it fights against bacteria, viruses, and other parasites. And the same immune system, it has cancer immunity as well. It has immunity against cancer. So if this immune system is suppressed, then the risk of cancer is more. And we cannot change aging. Aging is a very constant thing in this whole world. And with increased ages, we can see that increased age leads to different cellular problems, and as well as after age of 35, usually it is seen that numbers of cancer cases are more. Here I would like to mention, but with changing lifestyle and all, now we can see even younger people developing this dreaded cancer. So, but aging have a role. Then gender. It is seen that oral and oropharyngeal cancer is twice as common in men as in women. This needs more area of, it's an area of more research. And why it is so? Is it so because of the lifestyle of the male, or it is due to some genetic factors or hormonal things? So we need to explore more why our men is more commonly affected by oral cancer than female. The most visible thing is their use of tobacco and betel nut and alcohol. Now, what are the symptoms? The symptoms will be the person will have a sore throat, which is not healing. Usually, every one of us, we have a sore throat, but after 2 weeks, we heal it, or it is healed by some kind of, treatment. But in case of oral cancer or in case of head and neck cancer, it is not healing. Then the person will get difficulty in chewing and swallowing things. And in later stages, jaw or tongue will be very difficult to move the jaw or the tongue. And there may be swelling of the jaw. There may be, the tooth may fall or it may become uncomfortable. Then in later stages, there may be voice changes because we have seen a very commonly seen, we see tongue cancer. In a tongue cancer patient, we have seen a typical kind of voice, which we call hot potato voice. That is hot potato, as if a person is taking a hot potato inside his mouth and is trying to talk. So such kind of things is very much visible in, oral cancer. Or in there may be lump or mass in the neck because there may be some kind of metastasis. There may be weight loss, sudden weight loss, or there may be gradual. Very much this is also a very, not to be neglected sign, and the persistent bad breath. These are some symptoms of oral cancer. Now, how to diagnose? This is very important. Diagnosis is self-examination of the oral cavity one can do, which we have to educate the people. And I request the organization to do more awareness programs in the community level or in the school and college levels, so that the people understand how to do the oral examination, self-oral examination. And if not, then by health professional, of course. And self-examination of the oral cavity is a very, very easy process. Here we have to look and we have to feel. Now we have to look for any color changes in the oral cavity area, like red or white blue patches, any scab, any sore spot, any ulcer, and we have to feel for any lump. We do not have to skip any areas of the mouth, including the lip, gum, cheek, tongue, roof of the mouth, floor of the mouth. Everything should be meticulously examined. And that can be done by self, like in front of the mirror once in a month. If someone opens the mouth and properly, after washing his mouth properly, sees through these areas, feel it, then it is very easy for someone to find out a symptomless oral cancer in a very early stage. And oral cancer is also very much treatable, totally curable if detected early. So we have to be a little bit cautious and little bit, interested in our own health. So these are some, I have shown, this is leukoplakia. This is a potentially malignant lesion of the oral cavity. This is leukoplakia, that is white patch. This white patch has typical characteristic. It doesn't go away if we scrub it or rub it. But in case of other causes causing this white leukoplakia or white patch, this usually goes away. Like if someone is having candidiasis or some kind of dirty tongue, then if it is wiped, we can wipe it off. But in case of leukoplakia, it remains like that. And this is a red patch. This is a red patch. This is called erythroplakia. And this is same, like it doesn't go away, rubbing. And if this is seen in tobacco users, bidi users, any kind of, betel nut users, alcohol users, which we have to think otherwise. We have to think about it, that it may be erythroplakia or leukoplakia. For final diagnosis, of course, we may have to do the biopsy and all. But looking at the lesion, experienced eyes can, identify these lesions. Now, so oral submucosal fibrosis is a very irritating condition. Like I have seen it in females coming to my screening clinic. Like this oral submucosal fibrosis, it occurs due to the use of betel nut or pan masala or gutka. It is very rampant. And maybe like in my screening clinic, I have seen more female oral submucosal fibrosis cases than male oral submucosal fibrosis cases. Maybe because the female, they take gutka more. I don't know. We have to again study it. We have to again do scientific epidemiological studies for that. So this oral submucosal fibrosis is like when the mucosa becomes fibrosed. And it's a very irritating condition, very difficult to treat, even more. I think it is much irritating than a cancer case. Because the person cannot open the mouth, he cannot take any hot or silly food. Okay. So this is these are the potentially malignant lesions of the oral cavity. Now, what is potentially malignant? They have the potential to grow into cancer in later years. like after 10 to 12, even more or less, they can become cancers. So these are potentially malignant lesions. They have the potential of developing into cancer. So if we get a oral cavity leukoplakia or retroplakia, we have to closely monitor these patients. And if we can change their behavior to a great extent, we have seen that leukoplakia reverts back to normal, but under close monitoring, of course. And better to not to neglect and do the biopsy and all to find out if there is already any seed of malignancy. And erythroplakia is it has much more potential of developing into cancer in comparison to leukoplakia. But we should never neglect any of this. Now, the cancer cases, it may present as ulcerative, ulceroproliferative, or invasive. And there may be lump anywhere in the oral cavity or on the neck. Now, oral cavity, I have said, because nowadays in female also, we have seen that betel nut use, tobacco use is so rampant. So if the behavior remains like that, then in coming years, maybe we are afraid that we will get more oral cancer cases in female as well. So that's why I try to throw some light on oral cancer. Now, the most common cancer in female, it is the breast cancer. Now, breast cancer, when we say breast cancer, we do not say only the tissue which we know as breast normally, usually. But breast extends from the clavicle to the sixth rib, from top to bottom, and from mid-sternum to mid-axilla, from medially to laterally. And we should not forget the axilla. Yes. So this whole tissue is breast. The breast cancer means any lump in these areas. And in breast cancer, sometimes so happen that there is no lump in the breast tissue, which we know as breast in ordinary form, but we get a lump in the axilla. So we have to be very cautious about that, what we call a breast and what we call a breast cancer. Now, why breast cancer happens? Why it occurs? Breast cancer risk factors, we can divide it into two categories. One is we cannot change, and another is we can change. That cannot change is we cannot change our gender. We are born as female. So being female is a major risk factor of breast cancer. Then family or personal history. It is seen that breast cancer has some genetical predisposition. Genetical history is very important in breast cancer. And if someone in the family, like mother, sister, or any maternal aunt, specifically from the maternal side, they have a history of breast cancer, then the female concerned is at a higher risk. Apart from that, a female who had breast cancer in one of her breasts, she has the increased risk of developing cancer in her other breast as well. So this we cannot change. Then race we cannot change. In some races, it is much more common. Then genetic, of course, I have already said that genetic factors are like genes. Our genes are decided by our father and mother, and we cannot change our parents. We cannot choose our parents. Then menstrual history. Unless and until we play with our physiological process by some artificial, hormones and all, we cannot change the menstrual history. Menarche, if someone is having menarche at a very early stage and have menopause at a very late stage, that means the exposure to the fluctuations of estrogen and progesterone is much longer in that particular female. So this kind of menstrual history that we cannot change. Then reproductive history. Well, reproductive history, if we are willingly, we are not giving birth to a baby, that is a different issue. But if someone is infertile and not treatable, so that we cannot change. Then aging, of course. Increased age means increased risk of cancer. So these are some very important factors that we cannot change. But what we can do? We can at least change those factors which we can change. All women are at risk, but those female who are obese means their weight is very much unwelcome, like, they are very much fat or something. So this obesity is a factor which we can control. Nowadays, ladies are becoming much more aware about not being obese, but unfortunately, some people are still obese, and I request all of you kindly do the exercise and everything, because being healthy and being obese are two opposite poles. Then exercise. If someone do exercise regularly, this is a very much preventive step towards breast cancer. Then breastfeeding. If a female is not breastfeeding, she may develop in later stages breast cancer. Why not? That is nature. That is nature. It is the right of the baby to feed on her mother's or his mother's breast, right? So this is our duty as a female to breastfeed the baby. And that also helps our physiological process. Alcohol consumption. Alcohol consumption is also a factor which may lead to cancer, breast cancer. Then some female, it is seen that hormone replacement therapy, like whenever we play with our body, our physiological process, women are beautiful. Actually, every woman is beautiful. As a baby, she is beautiful. As a mother, as a wife, she is beautiful. As a lover, she is beautiful. As a as a mother, she is beautiful. Everything. As a daughter, she is beautiful all throughout her life, even when she is old. But when someone wants to remain young and someone plays with his hormones, then hormone replacement therapy may lead to or increases the risk of breast cancer. It is more common in the Western world. Like after menopause, estrogen replacement therapy is given to keep the lady young. But I request the ladies, please age gracefully. Accept your age, don't play with your body, God-given body. Then birth control pills. Birth control pills should be taken under supervision. And not having children. Not having children, if it is by choice, this is reversible, very much reversible. So these risk factors can be controlled very easily. If these risk factors are controlled, then the previous risk factors which cannot be controlled, they may not be boosted up because they need a trigger. And these are the triggers. So let us switch off the triggers. Now, what are the signs and symptoms of breast cancer? The most common symptom with which a lady presents to us is a painless lump in the breast area that I have already mentioned. Or they not. Usually this lump is often ignored because it is painless. And basically it is only when it is on a nerve or somewhere pressing a nerve, then only the lady can face or feel some pain symptoms. But usually it is a thickening or skin lump or not without any pain. That is why it becomes so difficult to identify in a very early stage. And there may be skin changes like puckering, dimpling, color changes, which is redness and all. Now, apart from that, we have to look at the nipple. Like the nipple may change its position. Usually the nipple it little bit down or at least a little bit, in a normal position. But if it goes if it is laterally pulled up, medially pulled up, laterally pulled up, very much upwardly pulled up, very much downwardly pulled up, or going inside. So these things we have to become very much aware that this is maybe some lesions is doing these changes. Now, scaling around the nipples. Scaling around the nipples is often very much neglected, thinking it's only a skin problem, dryness of skin. But no, we don't have to ignore it. Retraction. Retraction, I say that retraction is common in some people, which is present from the childhood, retracted nipple. All retraction is not a sign of breast cancer, but if we see the recent retraction of nipple that is going inside, then it may be due to the underlying pathology. And there may be nipple discharge. Nipple discharge may be white, maybe pus-like, maybe red color, or maybe watery. We should not neglect nipple discharge as well. Maybe there are some other conditions like duct ectasia and everything, like there may be nipple discharge. But whenever we see any lump, any nipple position change, any scaling, any retraction, any discharge, or any skin changes around the breast, we have to consult a physician immediately. And symptoms, and there may be size, changes in size. Normally, every woman knows her body, every woman we know our body very nicely, very properly. So if anyone sees any kind of changes in the breast size, like recently one breast is becoming bigger in size, or there is some changes in breast size, both of the breast or one breast, and there may be pain and tenderness. And as I have already said, in some we get pain or tenderness, or any sore, any kind of ulcer or sore on the breast that is not healing. So these are some symptoms. Like, what to do now? What to do now? Early diagnosis is the tool. Early diagnosis is the prevention. Early detection is the answer. In case of breast cancer, either the breast self-examination that is very easily available, that can be done by the woman by herself. Then clinical examination by MD or nurse. They can approach a doctor or a nurse. Or there are some high resolution X-ray like mammography, which can be done. So the most easy way out, which is in the hands of the woman, is the monthly breast self-examination. This is very, very easy. Very, very easily. It can be done very easily and within a few minutes, like 15 minutes. So, God has given us a very interesting tool. That is our palp of our fingers. We can feel a very small nipple with a palp of with our fingertips, right? We can feel it. Like even a nip, we can feel an acne, small acne. Okay. But this is so sensitive. Even I think an ultrasound, it will be difficult to find out a pimple. But our hand is so sensitive that we can use that as an ultrasound, and to do our own self-breast examination. So this is a lady who is doing, breast self-examination using her finger palms. One thing to be remember is never place your breast tissues between the fingers, because the breast, always remember, the breast is a gland. It's a gland only. It's a mammary gland, and it is already lumpy. So if someone presses the breast tissue or sees the breast tissue pressing between the fingers, then they should definitely get many lump and bump. So she will think that these are lumps and they will become very afraid. So that may carry a wrong message, like this should be done with your flat of your head, the up this position of portion of the head, and it should be done in a rolling fashion, like in a rolling fashion, little bit pressing, little bit. So now when to do? Now the question arises, when to do? Usually what happens during menstruation, the breast becomes very tender. And apart from that, due to some hormonal changes, the breast tissue feels different. So that is why usually this breast self-examination is suggested in female who has completed their 5th to 7th day of the menstrual cycle, menstrual period. That is 5 to 7 days after beginning of their period. They can do that on that particular day. And like in menopausal women, what should they do? Like in menopausal women, they can find out a particular date in the month, and every month they should do it so that it is not missed out. And in same date each month they should do. And in pregnant women also, because in pregnancy menstruation is stopped, so the same rule may be followed. And in I suggest each and every male, though I'm talking on the occasion of Women's Day, I'm talking about the most common cancer in women. But I also request all the males to do the breast self-examination, because in males, breast cancer may occur, can occur, though very less, but be aware and do the breast self-examination regularly. And then it takes only 20 minutes. I have written here 20 minutes, but it can take even less than that. And how to do? How to do is a very, very long thing, how to do. And we have to examine all the breast tissue. So I'll just explain. I don't think I have a picture. I have a picture, but this is very much small. Is it visible to all of you? Hello?
Yes, ma'am, it is visible.
Okay. Now, how to do BSc? This is breast self-examination, how to do. Look at your breast in a mirror. Look for any changes in size or shape, retraction of the nipple, dimple, or thickening, or any kind of skin changes or obvious kind of lumps. So first is see. Then, after that, you just you have to see it with the hands down and again hands up. Then again keep the hands on your waist and again see the same thing, like if there is any kind of position change in the nipple and all. And then the lady can lie down and one arm above, like that, and one arm she can fold, and she can all see all throughout the breast tissues with a rolling movement like that, and without pressing the breast tissues between the fingers, and little bit pressing little bit. And these are the quadrants. We should not miss any of the quadrants. Like it should be, it can be done up from top to bottom, or it can be done in a starting from the center going around the nipple like that. And this area should not be missed out. So this is a very, very easy process. Just we have to feel it. And mammography is another option apart from the MD. But personally, I don't suggest mammography to each and every female coming to me for breast examination, because X-ray exposure, I personally, think that X-ray exposure should be limited. And there are some guidelines, although American Cancer Society, they have said that 40 to 44 ages, between 40 to 44, they should start the annual breast examination, and the 40 to 45 to 54 should get a mammogram every year, and 55 above and older should switch to mammogram every 2 years or can continue yearly. But usually in our institute, we suggest mammography if there is a strong family history, and if the female is old enough, and if we if she really wants a mammography. Otherwise, we do the MD exam. We do the examination, by a doctor or a nurse. So this is a male cancer. This person, he hardly developed the breast cancer. And this is because the breast tissue in male is very less. It spreads very easily, very early. And in male, it is much more, deadly. So these are some late cases. No, I'll switch over to the cervical cancer. So cervix is a very important part of female organs. Cervix is the lowermost part of the uterus, and uterus is the part which we commonly call the womb. So this is the area. The cervix is the area which is so much exposed to the hormonal changes, and so much exposed to the different mechanisms of childbirth and everything. So this is very active portion in a female body. And this area, we have seen that cancer is very common in female. Now, thanks to our scientists, because the causative factor of this cervical cancer has been identified, that is human papilloma virus. And once we know our enemy, we can defeat our enemy. That is very important. And one question always it comes to our mind, that if anyone has exposure of human papilloma virus, is it so that definitely that lady will develop cervical cancer? No, not necessarily, because we have seen that 75% of the sexually active women, they have been exposed by HPV by the age 18 to 22. But we do not get 75% of female having cervical cancer, because most of the human papilloma virus infection is cured, and the cervix reverts back to normal. But only few of these the human papilloma virus gets into the cells of the cervix, and the infection doesn't go, and ultimately in later years cervical cancer develops. Now, who is at risk? Who is at risk? Yes, it's very important to know. Early marriage. In India, we have seen that early marriage is still a problem. So in early marriage, the cervix is not that mature, and early exposure to the infection is also there. Early marriage is a risk factor. We have seen that young age at first pregnancy. This is another risk factor. Then short intervals between pregnancy. Come on, the cervix is an organ. It also needs some rest. If it doesn't get enough rest, then why not? It will definitely, it will say that I'm not comfortable. So short interval between pregnancy should not be there. Poor nutrition. Poor nutrition, as I have already said, that poor nutrition is it is a risk factor of many most of the cancers. Poor hygiene, that is also very important. Hygiene should be maintained, because poor hygiene means more infection. Then women with STD, those women who have sexually transmitted disease, she has the chances of developing HPV infection as well. Then women with multiple sexual partners. Then husband with multiple sexual partners. Smoking, very interesting. So these are the risk factors of cervical cancer. Now, what will be the symptoms? Unfortunately, cervical cancer is asymptomatic at the early stages. Very much asymptomatic. And there may be white discharge, but people may ignore. They may think this is a normal phenomenon. Normally it happens, or it is a simple infection. So like that, It goes on years after years, and it goes to the later stages. There may be bleeding, which may be postcoital. There may be intermenstrual bleeding between menstruation. Or there may be again a menopausal woman, she may develop bleeding. She may be confused. My God, what happened? I started bleeding again. Most probably my menstruation started. But postmenopausal bleeding is a symptom of cervical cancer. There may be vaginal discharge, as I have already mentioned. Even in the early stages, there may be vaginal discharge, which is often neglected. There may be pain and rectal urinary symptoms in later stages, or backache in later stages. Now, what to do? If there is a problem, there is a solution. Awareness. In cervical cancer, we have to make the ladies aware that you should do a screening process. You should undergo a screening, which is a very easy process in fields from our institution. We do via visual inspection under acetic acid. We may do the VLI, that is visual inspection in Lugol siding, or in setups like BBCI, we have also pathologists. So in some instances, we go for pap smears. Now, here cytological test is Papa Nicolo that I have already mentioned. In VR, that is visual inspection with acetic acid. We just introduce a speculum. We just find out the cervix, and in the cervix, this is the mouth of the cervix. In case of VIA, we just paint the cervix with the acid that I have already said. That's the kind of acetic acid. That is the kind of vinegar only in a diluted form. So we paint it and we see for any color changes. If it is white, then we can understand, we can think that there are many differential diagnoses, but we may think that it may be cancer. So we may proceed for other investigations. And in pap smear, with the help of spatula and a brush, we take a little bit of epithelium from this cervical mouth of the cervix. We spray it on a slide and we just see for any kind of malignant cells. So this is so simple. It is so simple. So these are some guidelines. But in case of in India, visual inspection with acetic acid every 5 years for women between 30 to 65 years are suggested. And at least if we do the pap smear at least at the age of 45, 40, then at least for next few years, 20 years or 15 years. So we can say that if the lady is safe, if it is not there. Then primary prevention strategy is HPV vaccination. Nowadays in market, we get different kind of vaccines. Vaccines are available. There may be bivalent serotypes or there may be quadrivalent serotypes. Nowadays, it is incorporated to the ages before any kind of sexual exposure, 9 to 12 years. And CATSA vaccination is permitted up to 26 years. Vaccination is there, but the success varies. So we have to think about the other risk factors, and we have to do the screening. So this is very important. Cervical cancer, breast cancer in female is a very common, easily preventable, easily diagnosed, and very much curable. Very much curable. So these are the common symptoms of cancer. Caution us. Any cancer. C, changes in bladder or bowel habits. A, any sore throat not healing. U, unusual bleeding or discharge. T, thickening or lump in breast or anywhere. I, for indigestion and difficulty in swallowing. O, for obvious changes in water mole. N, for nagging cough or hoarseness of voice. U, for unexplained anemia or fever. And S, for sudden unexplained weight loss. So, coming to the end of my presentation, I'd like to show you our institution a little bit. This is a very, this chamber is very close to my heart. This is our thesis chamber. So here face-to-face counseling is given because tobacco is a major risk factor of cancer. And whenever we say control and prevention of tobacco of cancer, we have to give emphasis on control and prevention of tobacco. So these are some other pictures. We conduct, training programs. This is me. We conduct training programs all over India, all over Northeast. And because capacity development is very important, all of us have to work together to develop capacity in the field of cancer prevention and control. So these are some pictures in Nagaland and all. These are some rural areas, making tobacco-free zones. Ultimately, it's a united effort. It's an united effort. And this is the quit line. I'm very happy to inform you that Ministry of Health and Family Welfare have started National Tobacco Quit Line in our institution. There are only 4 institutions all over India. Out of that, one is our National Tobacco Quit Line. So always prevention is better than cure. Usually when we can, we do not want to. And when we want to stop, we cannot. Thank you very much. And now I'm ready to take any kind of interaction from your side. Thank you.
Thank you so much, ma'am. Participants, any questions? Any questions, participants?
I think either I'm very much clear, or I have talked in a different language, like okay. So
I think there
probably
is no question. So
thank you.
on behalf of yes, ma'am.
Thank you so much, Pallavi.
Yes, ma'am. Okay, so on behalf of IAPWC Kamrup branch, I would like to express my gratitude towards our speaker for today for devoting so much of time and imparting such valuable knowledge. I would also like to extend my thanks to the esteemed delegates for their patience, heartiest gratitude towards the IAP technical team for their IT support, without whom conducting today's webinar would not have been possible. Lastly, I would like to extend my vote of thanks towards our national head, Dr. Ruchi Varshni ma'am, East Zone head, Dr. Smita Singh ma'am, state head, Dr. Pallavi Goswami ma'am, and my district colleagues, Dr. Lopa Das and Dr. Tuis Lahon, without whose support today's webinar would not have been a success. Thank you, everyone.
Thank you, Dr. Urvashi, Dr. Srabana. I think I will end the session now. Thank you, everybody, for listening.
Thank you so much.